This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Welcome back to the show where we're talking about diabetes and diabetes education today with Diabetes Education Coordinator Andrea McCarty on staff at Mon General Hospital. What is an endocrinologist?
That's a really good question. An endocrinologist is a doctor that specializes in diseases of the endocrine system, diseases of metabolism. That includes diabetes.
All right, and you're proud to announce that you have a new endocrinologist on staff at Mon General.
We do. His name is Dr. Nadim Haq, spelled H-A-Q, and he currently has a full-time practice in Bridgeport that he is in the process of relocating to Morgantown. So he's here 2 days a week now.
All right, so what do you think that means as far as patients and Mon General Hospital having him on staff?
It's a wonderful addition to our physicians at Mon General because we didn't have a physician that specialized in treating diabetes and haven't had one for quite some time. So it's a great addition to our staff. That specialty or special experience he has and knowledge he has in treating our diabetes patients is going to help us tremendously.
So with diabetes education, knowing what to eat, knowing how to exercise, knowing how to keep that glucose level under 130, can we just live and die of something else other than something diabetes related?
You could. And our goal when we work with patients is we focus a lot on their blood glucose tests and the A1C result. And if you can keep the A1C less than 7% or less than 6.5%, according to the American Association of Clinical Endocrinologists, the risk for complications of the disease are actually no higher than it is for someone that doesn't have it at all. So it's quite possible to keep your numbers in target and live healthier with diabetes than maybe before you had it.
Initially, people with type 2 diabetes, as far as treatment goes, are put on regimen of pills or oral medications, correct?
Sometimes, but we see a lot of new diagnoses in type 2 that are not put on any medications yet. They'll use just meal planning and physical activity to manage it.
Well, that's the first thing you try, isn't it?
In most cases, unless at diagnosis the levels are very high, then the doctor may very well prescribe medication to help get those numbers down quickly.
Will you be on those medications for the rest of your life?
Maybe, but it's also possible that you may not. It depends on what type of behavior changes you can make in the way of meal planning and exercise. If you can make behavior changes that bring glucose down, you may very well be able to come back off of medication or even lower the dose.
Of course, losing weight is going to make the big difference. What type of exercising are we talking about? Hit the gym every day? Or are we talking about taking a stroll every night?
One of the things with exercise and the same with meal planning, we always encourage patients to do what they can do. Don't feel like, because I'm not doing what I should do what you can. And one of the most popular forms we see is just walking. And this week, the weather's been so great, it's a great opportunity to get out there and do some walking and become physically active.
And really, you only need 20 minutes to a half hour of walking, or what you can do.
150 minutes a week is all that's recommended. So if you do 30 minutes 5 days a week, you're reaching that goal. But if you're not used to any physical activity, it's best to start slower than that. Work up to 150 minutes a week.
If you're taking those oral medications, does your body get a resistance to them eventually? Do they become less effective? What I'm getting to is the insulin shots. And I know type 1 diabetics are familiar with the insulin shots, but now there's type 2 diabetics now who are taking shots from pens.
Correct.
That we see advertised often. So I'm wondering if their oral medications have become less effective.
The oral medications could become less effective, but not because the medication necessarily is your body's building up a tolerance or resistance to it. But diabetes is a progressive disease. So over time, your pancreas does continue to create and release less insulin. So if you're on very little medication now, 10, 15, 20 years from now, your pancreas may be making much less insulin and you would need more medicine. Regardless what you do, it's a progressive disease.
Those that don't get the A1C or get their glucose tested, what are the signs of diabetes?
If you have signs of diabetes, some of them will include being very thirsty and drinking a lot, and then peeing a lot too. You could also get real tired, particularly after meals. Some experience blurry vision, and some experience some pain, numbness, or tingling in their feet. Those are some early signs. But the only downside to that, if you wait until you have those signs, chances are your sugar is quite elevated and may have been elevated for a long time.
Yeah, I know that peripheral neuropathy is the numbness in the feet, and it's the blood. What was a narrowing of arteries in your feet, and the blood just doesn't circulate as well?
That's part of it, but also the nervous system is affected a lot by high glucose for long periods of time, and that also affects your ability to feel sensation on the bottom of the feet.
And that's why it's so important for diabetics to check their feet, because oftentimes, believe it or not, if you step on a nail or something, you may not feel it.
You're right.
And in some cases, hey, that's great, I can't feel the pain. But in other cases, if that gets infected and you can't feel the infection, that's where worst case scenarios come in, and there's amputation.
Right. And as you mentioned, if the arteries are narrower and healthy blood is not getting to where that infection could be, it's going to take a lot longer for it to heal.
What other complications can come out of this?
The most common one actually is heart disease, and not a lot of people link the two together, but heart disease is fairly common. High blood pressure is also fairly common. There's a higher risk for stroke. There's a higher risk for kidney disease. Diabetes is also the leading cause of blindness in our country and actually in the world. So those are some of the bigger ones, in addition to neuropathy, as Jim had mentioned.
304-296-0041 if you have a question about diabetes. If you have a question about what to eat, how to exercise, how to take your medicine, we can give you the information this morning with Diabetes Education Coordinator at Monongalia Health System, Andrea McCarty. We'll be back to Health Talk right after this.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
At the beginning of the last segment, we mentioned that there's a new endocrinologist on staff at Mon General Hospital, Dr. Nadim Haq. And so if we make an appointment with him now, will we get in quickly because he doesn't have a long list yet?
Yeah, you can get in. Most every patient within 2 weeks can be seen, but if you have an urgent need or an urgent experience, such as a low blood glucose or something along that line, you can get in within 48 hours.
Do you find that human nature is we don't like to change, we don't like to be told what to do?
Yes.
Yeah.
Yes.
In other words, you need to start eating this way and exercise, because it is a lifestyle change.
Right. And that's why we focus, through diabetes self-management education, we focus on what you can do, not everything you should do, but what you can do. And every person is different. Some people can do a lot of exercise. Some people can master the meal plan in a matter of days. Every person is different. So you're not a good diabetic versus a bad diabetic, depending on what you do. It's all a matter of what can you do and what are you willing to do.
It all starts at the grocery store, doesn't it? When we go to the grocery store, I mean, we need to know the right things to buy and the wrong things not to buy.
Partly, but one of the things we like to do in our office is teach you how to eat whatever you want to eat. It's a matter of the timing of when is it eaten and how much of it is eaten. And that makes shopping a little easier, but it might make fixing your plate at mealtime a little more challenging, because you do need to get out measuring cups, measuring spoons.
Right, so it's portion control is the key?
Correct, yeah.
Because a lot of us grew up thinking we had to have the protein in the meat, we have to have the starch, and most of us a vegetable.
Right.
You know, but maybe we need to break that cycle of thinking. We don't always have to have a starch, do we?
You don't have to. You need to have a certain amount of carbohydrate at every meal. And we try and encourage the same amount of carbohydrate each time you get a meal. So if you have just the meat and a vegetable and no starch, that vegetable, you probably would want to choose a vegetable that has more carbohydrate in it. And maybe you want to add some fruit to that meal, or heaven forbid, diabetes educator tells you you might have room for dessert if you did that. But it's all about choices. Which would you rather have at that time?
I'm sure other people going through the same thing as we are going through, then a support group may be a good thing to join.
Right. And what we offer a diabetes support group that meets the third Wednesday of every month at the hospital conference center at Mon General. And we meet it's a lunchtime meeting from 11:30 to 12:30, and our group is very casual. We only have maybe 5 to 10 people that come every month, and we usually have a speaker or a topic we'll provide more information on each month. This month will be a little bit of an exception. We'll meet on June 20th, and all of the educators and our office secretary plan to come to that meeting. We're bringing in food to potluck, healthy food choices, and we're going to do a diabetes trivia game just to highlight things that maybe people don't know that much about that maybe they should. But we have a meeting every month and allow an opportunity for a lot of questions to be asked and cover topics you might be interested in.
We only have about a minute or so left. Go back to Dr. Houck if we could,
Yep.
and talk about where he's from and a little bit about his expertise.
Dr. Houck has been practicing in Bridgeport for over 12 years. I met him 12 years ago when I was down there, and he is an endocrinologist. He's had his training here in the States, I believe, in Cincinnati and Pittsburgh, if I remember correctly from reading that before. He has the full-time practice down there that he's just in the process of moving here full-time.
So it's a real plus for
It
Mon
is.
General Hospital.
It really is. And he's very easy to work with, very pleasant, and all the patients that we have seen that have met him have been very pleased.
Great. Good to have him.
I know we can walk into the hospital in the front desk and find out where to get information about diabetes, but is there other resources, online resources, places that you recommend we go to learn more?
Well, Mon General's website, we have a link to, we do a newsletter every 3 months we send out to our patients completing our program. The past newsletters are linked on there, plus more information on our diabetes support group. Then other great information online, American Diabetes Association website, which is just diabetes.org, is always a wealth of information out there. And there's some other good resources too. DiabetesSelfManagement.com is another good resource too.
And where do we go for the support group so we can play trivia?
It's at the Hospital Conference Center at Mon General, the Hazel Ruby McQueen Conference Center at 11:30 on June 20th.
And should we call ahead and let you know we're coming?
The more the merrier. You don't need to call ahead or register, and it's completely free.
No beer and alcohol will be served.
Correct.
Yeah,
Correct.
Just healthy foods.
Yes.
All right. Thank you so much for the information this morning.
Thanks.
Andrea McCarty, and she is a diabetes education coordinator. She's a DEC.